One of the number one questions that we get in our practice is people asking, where do I start when it comes to incorporating a good nutrition plan and figuring out what to eat, especially when I'm in a flare? So today we're going to dive into that. We're going to give you a thorough explanation and we're going to give you a next step as to how you can actually get support with this customized to you. So I'm Ashley.
And hello, I'm Danielle.
We're the Crohn's and Colitis dietitians. We've been specializing in IBD. We have a practice with 3 dietitians, and we all happen to have IBD as well. So we're very interested in helping you and making this an easier process and less conflicting. So let's dive in. So does nutrition matter in IBD? So you might have been told by your provider that maybe it doesn't, but there's so much evidence now showing that it absolutely does. And not only is it important, but it can help induce remission. It can help you maintain remission. It can even help your meds work better, which is awesome. And we have a lot of potential when it comes to nutrition to using it in a way that can help to dial back symptoms. And that's really that customized piece that we work with people on. But we're going to give you a head start as to how you can incorporate some of these things right off the bat to get you in a better spot. And we also know that it can help to decrease risk of complications in surgery. It can help with, certain nutrient deficiencies are correlated with flare-ups. And the diet itself can play a big role in whether or not you're in a flare-up or in remission. So talk about some strategies here in a minute.
One of the things that often comes up for people with IBD is that food and symptoms can go hand in hand. And when those symptoms are present, people with IBD may over-restrict foods unnecessarily. Now, as Ashley said before, with us both having IBD, we can totally understand the thought of having less food because it is something that may cause pain. But we want you to know that there's different strategies to help decrease that, and that over-restriction has an impact when it comes to your food intake as well. So as you can see from this slide, there is a lot of things that come to mind when we over restrict foods. Some of the big ones being that you can actually lead to an increase in symptoms, unfortunately. With that too, when we have less food, there's less diversity in the gut, meaning there's less of that beneficial bacteria in the gut and not able to perform in the same way. With that, when we eat less, there's often less blood flow and oxygen to the gut, and we need that blood flow to optimize digestion, to ensure that things are working well. We also may notice slowed motility, which means constipation for some people. With constipation, that may lead to more symptoms. Again, that could be like bloating, nausea, and so on. And then, of course, restricted eating is something that us dietitians are often thinking about. Less nutrients are also another item to be mindful of. We eat less, we're going to take in less nutrients. And when you're working on your journey with IBD, we want to look at optimizing nutrients to help your gut work in the best way that it can. And like Ashley said, when you put nutrition and medication together, they can optimize each other. And then the 2 big final things as well is that when we over restrict food, we can see less energy, which can lead to more fatigue. With all of this together, this can lead to less gray matter in the brain, which may lead to more restrictions and lowered stress tolerance, something that nobody needs when they aren't feeling well.
Yeah, and I also wanted to add, so even if you're not someone dealing with constipation, this may also play into additional bloating, abdominal pain. You might even have throwing up and nausea. And sometimes it can actually increase even stuff like diarrhea and urgency when you have a change in peristalsis and less fuel for the body can actually backfire and turn into more symptoms. So lots of different ways that this kind of pattern can play into stuff when originally you might have been taking foods out to avoid symptoms. In the long term, that's where we can see some of the negative impacts of that.
Mm-hmm. So instead of completely restricting, we like to focus more so on adjusting certain types of foods or changing the particle size of them to make them easier to digest. So instead of spinach, we're doing spinach in a smoothie, that sort of thing. Now, when it comes to nutrition for IBD, with this pyramid, we want to focus on the bottom, the biggest chunk first, and slowly work our way up. So when we're thinking about nutrition for IBD, we always want to make sure that people are getting enough food intake in general, enough calories in general to ensure their body can recover from what's happening in the body and to maximize nutrition so that you can feel your best. So we want to make sure that we address nutrient deficiencies, get enough calories in, and ensure you're staying hydrated, because we also have to be mindful of malnutrition, which is unfortunately common in IBD.
Malnutrition means poor outcomes when it comes to response to meds and a poor immune response.
Absolutely, yes. So the next little block in our pyramid is to prioritize rest and recovery. And this is a phrase I've heard a time or two from people. And I feel like I heard it more when I was in my 20s as well. It's like, oh, well, I can sleep when I'm dead. No, 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 I disagree. And the reason for that being is because when we prioritize rest and recovery, that is how our body recharges itself. So please, please drop that saying out of your vocabulary, and please take the time to rest and recover, whether that's slowly focusing on a more optimal sleep routine or planning for, afternoon naps, if that's something you need, or whatever it may be, because this is an important part of your body healing. The next little bit we like to focus on, our specialty, if you will, is diet expansion. So we are focused more on adding more variety in your different fiber sources and different healthy fats, prioritizing more of the anti-inflammatory way of eating, which we will talk about in the coming slides, and ensuring that your gut can be thriving with all of that different variety by modifying the particle size as needed based on your tolerance. So when we talk about particle size, it's like I mentioned before, some of those roughage foods like your spinach or your other leafy greens, your nuts and seeds, that may be slightly irritating. That doesn't mean you're causing inflammation. So by adjusting the particle size of it, blending it into a smoothie, using nut butters instead of nuts, that adjusts the particle size, makes it easier on the gut and less irritating. Okay. So clarifying triggers is our next one. We as dietitians like to take a look at, someone's symptoms, to seeing if any foods kind of match up with their symptoms. And a dietitian can be really helpful for this because it's something that we are very aware of, not only from an IBD standpoint, but if there's any other maybe intolerances to be mindful of, or higher FODMAP foods that you may be having problems with. And we have the knowledge and way of picking that out so you don't have to track it entirely yourself. That's what we are here for.
Sometimes you can spot patterns too that you might not see until you have somebody that's seen it many times before, and then you can kind of find the pattern in the potential trigger. It may not be what you think. So I think that's another area.
Yeah.
And I'll add too, I think a lot of times people will think that the diet expansion piece, I don't know if you've seen this, but they'll think, well, I'm going to wait until I'm out of this flare before I do any diet expansion. I'm going to wait till I'm out of the flare. But it's actually the reverse. We help people with diet expansion while they're actually flaring, and not to trigger more symptoms, but we do things in a way to help lessen those symptoms using that diet expansion and clarifying triggers. And we're going to get into in a minute what those triggers are, because there's more than one type of trigger.
Absolutely. Yeah. And not always based on the food that we eat, but it may also be on how you consume the food. Meaning, if someone eats too quickly, you may be experiencing indigestion. We talk about tips to combat that as well. Or just, bringing in more mindfulness when eating. So there's always lots of stuff that we have our eyes on. The last little bit of the pyramid is to, of course, focus on reducing overall risk when it comes to IBD, prioritizing more that anti-inflammatory way of eating, reducing risk of flare-ups in the long run, and nutrition can be a big part of that. So talking about the long-term outlook and how to plan for that, as well as discussing and going through nutrition related labs to be mindful of to optimize your nutrients and to ensure all of those look just great for IBD.
Okay, so this is a really important topic. I want to talk for a second about the 4 types of remission because this can really clarify and give you more understanding of where you're at and how your IBD is actually doing. So a lot of times people will assume that if they have an uptick of symptoms that they're automatically in a flare-up, but that's not actually the case because there's many different types. Or you might automatically assume because you're not having any symptoms that you must be in remission. I see that a lot, especially on forums where people are just not even monitoring their IBD anymore. So it's important to clarify that there's actually 4 different types of remission. So there's symptom remission where you're not having symptoms like that could be anything from mucus in the stool to diarrhea, constipation, bloating, abdominal pain. Those are all in that symptom category. They're not necessarily an indication of inflammation. And if you're not having any symptoms, that doesn't mean that you don't have inflammation. And then biochemical remission is where you don't have inflammatory markers that are elevated, like your fecal calprotectin, CRP, sedimentation rate. It's important to know, like I said before, that you can still be symptomatic even if your inflammation is fine. And then the other way that we look at inflammation in IBD is through colonoscopy. So that's an important way to look at it because sometimes markers don't elevate and you have to have this regular looking at it from a colonoscopy perspective to really get an idea of how someone's doing. So the 3rd type of remission is where you're looking at it from a colonoscopy perspective. So visually, it's not showing any signs of active disease. And then histological means after a biopsy, they're not showing any active disease and it can look almost like a normal healthy colon. So, the end goal is always remission with IBD, but it's important to clarify what type of remission we're talking about because we do want to see symptom relief for somebody, but we also want to see inflammation relief. We want to see if we can, the treatment route that we're taking, if we can get to these deeper remissions where disease is more likely to stay stable longer if you can get to these deeper remissions. And I wanted to clarify that because up to half of people with IBD, some studies are showing about half, will also have overlapping IBS, or maybe not even IBS, maybe they're just having symptoms even when the disease is stable. So symptoms that could mean a number of different things. It could be malabsorption of fat, and that's driving some of the symptoms. It could be malabsorption of something else, like food related, or it could be IBS. And nutrition strategies are very effective at helping with that. So if you are symptomatic, bringing in nutrition strategies and an expert to kind of help you identify what's happening can be really helpful. But yeah, important to know that a lot of people associate symptoms as inflammation, but that's not the case. We have to look at labs and colonoscopy to really detect if there is or isn't inflammation there. But you can have symptoms from inflammation too, but important to clarify that you can have it both ways. And then let's dive in for a second to the different types of triggers with IBD. So a lot of people think that it's just a trigger, like this is trigger food and I'm going to take it out. But it's important to know that there's 3 different types, and knowing what type and really understanding what's happening can help prevent you from over restricting and can help give you opportunities to expand the diet. So the first type of trigger is a symptom trigger. So that's a trigger that doesn't cause inflammation or impact the IBD, but can cause symptoms. So those are often going to be fruits, veggies, things that might trigger in IBD symptoms, but we can modify, like Danielle said, we can do a lot of modifications to try to mitigate symptoms, or we can slowly expand the diet over time and in steps. So example would be maybe if you're not doing well with broccoli, we start with something like broccoli sprouts on a sandwich and then kind of build over time or throw it into a smoothie. And what you can do is build tolerance. Your gut's like a muscle, your microbiome's like a muscle. The more that you work it, the more that you can see positive impacts. But a lot of times, especially in IBD, that needs to be done with a dietitian because there can be a lot of obstacles in IBD that can make it more difficult to expand your diet, especially stuff like strictures, which is very common in IBD, where you might want a lot of support and modifications along the way. And then the second type of trigger is inflammatory triggers. So it's not a one-time thing that causes inflammation or a inflammatory flare in IBD, but it's typically a pattern of eating in the long run that can increase risk of flare up and inflammation. It may or may not impact symptoms, but the bottom line is that we know that it can increase risk of, flare up and increase the disease activity. So we'll go over what those are in a second. And then trauma and fear triggers. So these are things that maybe you've had fear with food, maybe you've had a stricture and an obstruction, and you've associated that food with the painful event that happened. And so then that might be a trigger just based on that alone, just based on the fear response. Or even let's say you're in traffic or in a line at TSA and you don't know that there's bathrooms around, and even that alone can trigger a response. I think we all can relate to what that's like, especially if you've gotten afraid really suddenly, or there's a number of different ways that could happen. And so working on your relationship with your body and with food or whatever the trigger is, and maybe even working with a GI psychologist who kind of specializes in that connection can be helpful. And so connecting all the dots here. So even though I think a lot of times people are given advice to limit fiber and residue, especially if you're fresh out of the hospital, when we look at the long-term goals with IBD, we actually don't want to avoid fiber because it's associated with a greater risk of flare-up when we avoid it. And people are 40% less likely to have flares when they are keeping a diverse diet. And we know lots of other things with that too, like leafy greens and grains are associated with decreased fecal calprotectin. There's a number of stuff we know about the microbiome, like having a diverse diet with 30 or more foods can improve outcomes in terms of gut health. There's many things that connect to these points that we know are important for gut health and for IBD and reducing your risk. So we want to find ways to bridge that gap between including more things that are gut friendly without triggering your symptoms.
And last but not least for today, we have this overall big picture view of what to eat with IBD. As you can see on the slide, we've broken it up into foods to have less of because they contribute to more of that inflammatory pattern to promote disease. And then we have another side of the slide where we want to encourage more of certain foods to have more of that anti-inflammatory effect. As you can see, the ones we want to have more of are rich in fiber and healthy fats like your omega-3 rich fish and other healthy fats too, like your olive oils, avocado oils. But the foods that we want to have less of are things like your red meats and processed meats. So that includes both beef and pork, hot dogs, bologna, that kind of stuff. We also want to have less myristic acid, saturated fats. Those are found in butter, dairy fats, palm oils, and coconut oils. We want to have less artificial sweeteners and certain additives like polysorbate 80, carrageenan, and carboxymethylcellulose. Those items are often found in pickled products or a lot of dairy products as well. And the good thing about it is that there's lots of products without those additives too. So they do exist. They are out there. It just requires a little bit extra reading sometimes. And last but not least, sulfites and nitrates are other things that we want to have less of. And same with your high meat and dairy intake and low fiber. We can understand where low fiber may be necessary at times, but with the overarching goal of slowly increasing fiber intake over time to benefit your gut, which is why we want to have more of these lovely whole grains like your rices, your oats, your plant-based proteins like edamame, tofu, tempeh, legumes. And the reason we want fiber is because we're always focused on that lovely gut bacteria. The fibers in plants help to grow our beneficial gut bacteria, whereas the items on the other side of the slide with your high fat, high processed foods can contribute to more of that negative bacteria that we want to see less of. So we're eating for our gut bacteria. And when you work with a dietitian, well, we help you find different recipes. We help you cook up and create different ways of incorporating these things into your life to make it not as intense, and so that you have someone guiding yourself along that way because we have done it before. So we want to focus on plants in the diet slowly because really want to focus on stuff that you can tolerate as well. So again, working with a dietitian can help you to determine what your individual basis is and how maybe soon we can bump up the diet and slowly add more things in.
Yeah, I like what you said about how we're not just eating for us, we're eating for our gut microbes. And that's really why these things really matter, is because our gut bacteria produce things. So as a result of getting food. So the more helpful gut bacteria will produce really positive, helpful things for us. That's why they're in the helpful category. So things like short chain fatty acids like butyrate, propionate, acetate. You've probably heard a little bit about butyrate before. Butyrate is the fuel source for our gut cells. It can help with repair. It can help with improving our gut barrier, which strengthens the immune system. It can help with reduction of inflammation, not just in the gut, but more systemically. So we get a number of really great effects from getting those positive things that our gut bacteria produce. And the opposite is also true. So when we have things that feed up gut bacteria that we don't necessarily want to be high, but can increase damage to the GI tract, and we certainly don't want that to happen. And again, these things are not one-time things. It's a pattern over time that is what makes the biggest difference. But also in that same vein, we can also see that changes can start to happen even in the first 24 hours of introducing some of these things into the diet. You can see positive changes in the microbiome, but you may not notice the effects of that, even for 3 to 6 months. But if you want kind of a more customized approach to helping guide you through this process of adding things back or coming up with strategies to really reduce symptoms, so eating in a way or adding something in to reduce symptoms, or if you want guidance around even stuff like supplements, like what's actually legit and has research behind it and what can you let go of and not worry about, we can help you with connecting the dots and providing that path for you to go where you are now to reaching your goals and where you want to head, and reducing your risk over time, improving energy. We do track some of these impacts in our practice in terms of what the overall percentages of people are that are able to reduce symptoms and are able to improve energy. And we have great results with that. And I think it's consistent with what you see in the research as well, in that we know that it's important for IBD, but it does require a little bit of strategy and working with someone through that. But I hope this was helpful for you in terms of connecting the dots. We did this same training back in 2022, and it's one of our most popular videos. So I thought it was time for an update. And yeah, I hope this is beneficial. Leave us a note in the comments, and don't forget to like and subscribe so that you can get alerted when we put out new content.